Starting from the 21st of February 2020, some of our Italian healthcare customers started to show what will all then identified as the beginning of the COVID-19 pandemics in Europe. This was the case, for example, for the Cremona Hospital, which is right next to the epicenter of the Italian first pandemic wave. Well, it was a real wave of patients reaching the hospital with respiratory and other disorders. So, as a medical gases company, served all the rapid increase in liquid oxygen consumption by hospital and immediately understood that something major was happening. Later, we calculated that this rapid increase in the oxygen demand was triggered on one hand by the single patient's consumptions, with values ranging from 5 liters per minute as high as 60 liters per minute per patient. This also caused oscillations in the demand. On the other hand, an increasing number of hospital beds were also added. Following the hospital reorganization of intensive and sub-intensive care departments, Sol, together with other medical gas companies, helped hospitals to organize changes to adapt the medical oxygen systems, also with the installation of additional cryogenic tanks. Medical gas companies also had to increase the number of cylinders available to hospitals in wards and in emergency rooms. As cylinders clearly represent a finite number of assets, the importance of returning empty cylinders to medical filling centers was underlined. All in all, what we can say is that all requests of cryogenic oxygen have been covered in Italy and, to our knowledge, in Western European countries. The commitment of all medical gases suppliers throughout Italy was important. It was reported by both local and national press. The national figure for 2020 is a consumption of 125.4 million liters of liquid oxygen, compared to an average annual consumption of 95. On a national basis in 2020, an average increase of around 25 to 30% can be assumed. And to give you another figure, in the first half of 2021, consumption was 98.7 million liters, showing the doubling of standard yearly hospital consumption. On the other hand, oxygen cylinder deliveries increased by 25%. In some hospitals, on particularly critical days, consumption increased by up to 600%.